It's true. And I could like, that would be available. And
Yes, yeah,
I didn't realize I would be high.
Yeah,
I think it's merging, like as you continue to kind of supposed to focus in on you, but I don't know.
and it's not in his share. Okay.
Talking from the front. Yeah, that's right. As soon as everybody's quiet, she starts talking.
Yeah.
So really.
Oh, I see now. It's like it's. Well, for a while now, thanks for hanging it out here. Good to see you. Have people come on in. It feels like, you know, it's probably a good thing. Yeah, we say, but yeah, we need to throw it.
Are you going
Good, how about you?
That would be nice.
I've got tea. Like, if you're talking from right here, it should. At some point. Very. I am doing some of the things out here. I think you Yes.
I need to follow. So. Okay, I think we're just gonna get started. So I'm John Slattery. I'm the director of the Grefenstette Center. Thank you so much for joining us today for our last faculty colloquium of the semester. So each of these are simply monthly conversations around various parts of ethics of technology, AI, that are focusing on faculty and staff around Duquesne University. Please help yourself to coffee and snacks, both during and after. And you can also pick up some awesome goodies. If you wouldn't mind signing in, at least just to give us your name and email, if you want to be on the mailing list if you're not ready. And thank you also to those of us that are joining virtually. Glad to have you here. It's our first time doing it via Zoom. So it's we're still working out the kinks of that. So appreciate your patience with all those things. But today we're really honored with Dr. Theresa Stujenske and Dr. Lauren Sugden, who are joining us to talk about their fantastic research that very much crosses into these thresholds of technology and ethics in lots of interesting ways, right? If you've done any work with the Grefenstette Center, you know that the way that we think about ethics of technology is very broad. We don't have a certain myopic vision around it. There's lots of people that are working on issues that intersect with ethics of science and technology, with AI, with data science, and what that means broadly speaking. So our center is always based around the Catholic intellectual tradition and coming out of ethical beliefs from that tradition, but that means a lot of different things. And that is also a sort of a pluralistic idea about what ethics might mean and how it applies both to people of faith and to people in general around the world today. So with that in mind, please join me in welcoming Dr. Stujenske and Dr. Sugden to speak today.
Thank you so much for that introduction. And I'm very excited to have my colleague, Dr. Sugden, to do this presentation with me. I think what's most valuable about these conversations is to have multiple viewpoints and multiple perspectives, which is why I really wanted to have both of us here. So, you know, certainly Dr. Sugden is a data scientist. She looks at data, she looks at a lot of it. I'm a clinician, I'm a researcher. I also had the opportunity after my postdoctoral fellowship to work in the private sector. I thought that academia maybe wasn't for me for a brief point. And I worked in women's health testing. So I also got the perspective of business, brief perspective of business. And I think it's important to try to keep everybody's perspectives in mind. Oftentimes with these conversations, there's many different stakeholders, primary stakeholders, that we have to address their main interests before we really think about this meaningfully. So in terms of the
Well, click on the slide first with the mouse, and then it should work.
So the objectives of this is to present the dilemma, the primary dilemma of data privacy in digital health tracking, and provide an overview of the key stakeholders involved in this dilemma. We're also going to offer a few solutions to the dilemma, though this is really meant to be a conversation. Hopefully, we can think kind of collaboratively on this conversation and put everybody's brains to work. So first, if you're not completely familiar with menstrual cycle tracking, this is an exploding field of digital health tracking. There's over 100 million women. That's just an estimate currently. Around 1/3 of reproductive age women who are tracking their menstrual cycle information using an app. Sometimes that app can be paired with other tracking technologies like a ring. Some of you have maybe heard of the Oura ring if you watch TV at all, or you've probably seen one of those advertisements. Natural Cycles is paired with an Oura ring. There's other different technologies depending on the space that you're familiar with. You can see the dollar sign there. The industry is expected to exceed $60 billion in the year 2027. Certainly from a business perspective, a very interesting and growing field. These apps allow women to track menstrual cycle information and provide predictions regarding future menstruation and ovulation dates. There's numerous benefits to menstrual cycle tracking. I mention this because it frames the problem or frames the situation or the context. why are people using these technologies? Well, obviously they find them to be useful, right? So what is the primary use? They provide important insight into overall health. They allow users to have a record, an ongoing record of menstrual health information across various reproductive stages and across various. They help to identify underlying health conditions, and they provide information regarding fertility and family planning. The main scope of this conversation is not around the clinical utility of these apps. That would be a whole nother conversation, a whole nother lecture. This is really the focus is on the nature of the data that is tracked in this app, these apps. Yeah, no, that's right. One more. So what kind of data can they collect? This is certainly just some of the types of data they can collect. Certainly when you're looking at privacy, you're trying to figure out, well, what is the subject matter, right? The subject matter here is things like the first day of a person's or a woman's menstrual cycle, things like bleeding patterns, body temperature, basal body temperature across the menstrual cycle, things like pregnancy intentions, health history and medical diagnoses. Sometimes actual hormone levels can be entered. Symptoms across the menstrual cycle, mood patterns, all can be tracked, and this is not all the data that can be tracked, but certainly some of the larger categories. Of interest, ChatGPT was used to generate this image. Want to give credit where credit is due. But mostly I was trying to say, like, certainly there are many different stakeholders involved in this conversation. So who are those stakeholders? So certainly the consumer, right? The user, the person who's downloading that app or using that technology. The company, you can see that in the right there. The companies are certainly interested in profit. They're interested in their consumer base, in building trust with their consumer base. And they're interested in efficiency, right? So companies want to, improve efficiency of their users' lives, and increase efficiency within their business as well. Researchers are clearly interested in the data that's collected, and certainly interested in it being stored and collected and disseminated in an ethical manner. So they need to be, they're only using data that's, been collected and stored in an ethical manner. We'll kind of come back to that when we talk about some of the implications for research. And then the government is certainly interested in all of those stakeholders, protecting all of its citizens, whether they be users, part of a company, a researcher. I would say I could fall under, I have at some point fallen under the top 3 categories. I've never fallen into the government category per se, but certainly the government's primary interest is to support and protect its citizens and also to protect the growth and development of new businesses. So the dilemma explained. So what's the real dilemma here, right? Like, what is there any dilemma? So using menstrual cycle apps requires that personal data about one's menstrual cycle essentially be given away, right? So the transaction is data for a service. Many of these apps that might be a crude kind of basic explanation of that exchange, but it is what is happening, right? So many of these apps you can download for free. It's not free, though you're paying for it with your data because your data is valuable. And you may or may not know it, but that is how companies are able to use or to make profit. I worked in the private sector for a year, and that's how they're able to keep the cost of these services down. So that's beneficial to the user in many ways, right? Because otherwise we'd be paying hundreds of dollars a month to use these services if there was no other way for the government or for the company to make a profit, right? And certainly we can talk about all the pros and cons of that and whether that's okay or not, whether companies should be allowed to sell data. The reality is, in the United States, there's very few limitations on the selling of data. So the user has to commit to the idea that without giving up their data, which is the input, they won't get the vital information that they need, which is the output. So purportedly, the greater the level of information given up, the greater the accuracy of feedback from the app. As Carlson explains, to gain knowledge about one's own body entails giving away access to data generated from that same body. So they kind of coin the term a prosumer. you're producing and consuming the data, right? So interesting term, certainly not a real term, but interesting. So then who does the data belong to? Well, fundamentally, once the data is entered into the app, the individual does give up rights to their data. So it no longer legally belongs to the user, and the company may do with it as it will. The user will surrender their rights to their own data when they consent to the use of the. So that kind of brings us to the interesting question about regulation. So how are menstrual cycle apps regulated? Well, they're regulated in the same way that many other or all other apps are. In the United States, essentially. Here, I'll just. No worries, take your time. If you're just.
Yeah.
Like, so how are these apps regulated? How are apps in the United States regulated? So in the US, companies can collect, store, or share data in any way they want with whomever they want, and data usage is not limited to targeted advertising. In addition, companies do not have to notify the individual, the user, when they share or sell your data, and third parties that obtain your data can continue to sell or share it without your knowledge. So you can imagine just who could ultimately end up with your data. Now, typically this is de-identified data, but there are, ways like loopholes in which companies can re-identify data by using IP addresses and things like that. Certainly you could get into a rabbit hole, like really trying to figure out whether they could actually identify your data, but that's sort of besides the point. Once it's de-identified, and they remove sort of like personally identifiable information, it's sort of typically shared in aggregate. In the United States, there are no specific general federal data privacy laws. With the exception of some state laws, almost any health information entered into an app is not protected. So you can see this, article that came out in The Guardian. There's been many since articles with changes in legislation that have brought to the forefront some of these conversations around privacy concerns. But my opinion after reading some of these articles is we're having this conversation now. I mean, why does it matter if it's legal or not, right? I think sometimes we think well, if our data, is being shared legally, then what's the point of even having a conversation? So I'd like to bring up an absurd example here, right? So say it was legal for someone to just peer into your house and I don't know, spy in your house and collect random information. And then they could just sell whatever their observations were on aggregate, right? Say that was legal. Well, I think just from a socially acceptable perspective, at least the way our culture is now, no one would do that, right? Because we value our privacy, right? We value that intimacy of our home. And I would argue that menstrual cycle data, as well as many self-tracked health data sources, are of that same nature, right? They're private. You're kind of entering a person's intimate space. And we're not seeing it within that lens. And we're not valuing it within that lens. The most rigorous kind of privacy law exists in California, and I think there's one in Virginia as well. But you can see it's sort of some of these things seem fairly obvious, but they're not true of all states. So this is the California Consumer Privacy Act, the CCPA, the right to know about personal information that a company is collecting, the right to delete personal information collected from them, the right to opt out of any sale or sharing of personal information, the right to non-discrimination, the right to correct inaccurate personal information, and the right to limit the use and disclosure of sensitive personal information collected about them. Wouldn't it be great if all states adopted this? So what is privacy is certainly a fairly vague and broad term, but it encompasses concepts like the right to bodily integrity and freedom from invasive searches. Article 12 of the Universal Declaration of Human Rights from 1948 states no one shall be subjected to arbitrary interference with his privacy, family, home, or correspondence. So while we would imagine that a broad interpretation of privacy would apply to digital data, in practice, governments and service providers often fall short of meeting the standard. So you would hope that people would take a fairly generous standard when they apply the standard in practice, but that's in reality not the case. So end user license agreements. So this is essentially every time you download an app, it has legally you have to accept the terms of use or the TOS and the privacy policy. And usually, if you remember the most recent time you downloaded an app, you don't even have to read those things. You just click accept terms of use. And if you were interested enough and you had the time, you could, in some apps, access those terms of use and privacy policies. And then you could scroll endlessly and read that privacy policy. You may not understand most of it, but you could still read it. So what is a privacy policy? This is a legal document that explains how a company handles personal information, including how it's collected, used, and disclosed. They're often lengthy and unlikely to be read by most users. A recent study found that of the 15 most popular cycle tracking apps, none of them required users to view the app's terms of service or privacy policies. So it was just like, I have read and I accept these terms. Another study done in 2020 conducted a systematic analysis of 30 menstrual cycle tracking app privacy policies. They found that many of the app's privacy policies used ambiguous, obfuscating, or misleading language. 4 of these apps did not have a privacy policy available, either in the Google Play Store or in the app itself, accounting for 11.5 million Android downloads at the time of the analysis. Out of the apps with a privacy policy, an overwhelming 66% did not mention that they specifically collect menstrual cycle data in their privacy policies. So not much for a privacy policy if it doesn't even address the specific nature of the content that is being tracked. So the first step is read the policy, right? But if it's not readable, you can't read it, right? So there's been studies looking at the readability level of these policies. The Flush-Kincaid grade level is oftentimes used to essentially score the readability. And the score is correlates with a grade level. So 8 would be 8th grade, 9th would be 9th grade, freshman in high school. 13th would be essentially college level. So there, you cannot see this, but it's okay. It's I can just give you some basic overview. This was from a study that was done looking at the readability and accessibility of the terms and services and privacy policy for 15 menstruation tracking apps. Well, from your seats, you can probably see these are all in the double digits. So the readability is well within, late in, high school, or in some ways, in many of them, you have to have at least a college level education. You can see words per sentence here. What I thought was most interesting is they actually wrote down that, or calculated the number of scrolls it would take to actually read the privacy policy. So for Clue, which is one of the top, apps, to read the privacy policy, you'd have to scroll a whopping 34 times. This is a crazy example, but Eve, you'd have to scroll 62.5 times. So you're not going to do that, right? Which means that it's not readable, which means it's not accessible, which means that is the privacy policy for the user to protect the user, or is it to protect the interests of, the legal implications of, for the business? So bottom line is Americans frequently skip reading privacy policies. You can see here that, this basically says that, over 56% of Americans are essentially always or almost always skipping reading privacy policies. Here, interestingly too, it's looking at the readability of privacy policies. The average privacy policy is 2,464 words. The US Constitution is 4,440 words. You can see that you're not gonna read a privacy policy if you essentially have to read half of the US Constitution every time you agree to, what it's stating. So the bottom line is the burden of consent is on the user. Many privacy policies use the language of individual responsibility to address data protection against, essentially, the user is responsible for how, for them agreeing to the unreadable policies set forth by the company. Essentially, if there are any changes to that policy, the user also needs to be, essentially, it's their own responsibility to determine if changes have been made. This obviously places the burden on those who use these platforms rather than on those who design or profit from them. Some policies state users must be careful about sharing personal data, or that it's users' responsibility to periodically check companies' policies for changes over time. So I thought this diagram was quite interesting here. So what is the acceptable trade-off, right? So obviously people are still using these apps, right? They're willing to make that trade-off. They see the benefit of this service, and it's an acceptable trade-off, right? So you see here on the bottom line, max utility, and over here, max privacy. Obviously, it'd be great if you could have max privacy and max utility, but that doesn't work, right? So we are willing to make a sort of trade-off in how much of our data may be sort of at risk, you could say. So my question that I pose is, does menstrual cycle data deserve greater protection? Should we look at it in sort of a different lens than other types of data that can be tracked, right? In my personal opinion, maybe others would view it differently. The data that you track using a Fitbit, right? Fitbits can actually track menstrual cycle data now too, so it's probably not the best example, but just like a step counter, right? I don't really care if someone has access to how many steps I take on a regular basis. That doesn't feel particularly private. And certainly you could say, like, from a widely observable standpoint, if someone cared that much about counting my steps, they could just follow me around and count my steps. It's not private, right? Like when I'm outside my house, I'm walking around, and menstrual cycle data seems to me, again, this could be a conversation for debate, but it seems to me much more private. And within the health setting, this would be protected by HIPAA. Outside of the health setting, so anything outside of a doctor's office is not protected by HIPAA. So this is not protected by HIPAA if you enter into an app. It's intimate information regarding an individual's sexual and reproductive health. So in my opinion, it should be given greater protections. Eve or Glow, which is another app, said that you should be extra careful before instructing us to share that information with anyone else. Your menstrual cycles, fertility information, and pregnancy status is much more sensitive than the number of steps you took today or where you were when you took your most recent selfie. All right, so now we'll move a little bit towards kind of the researcher. And this is where I'm gonna have Lauren share some of the value of this data from a research perspective. So certainly we know that this data is being used for research. So how is it used for research if we're not actually consenting the individuals participating in the studies, right? So essentially FLO's privacy policy in terms of use permit the use of aggregated and anonymized data for research purposes. These are just pulled out of some different studies. Aggregated and anonymized does not follow traditional informed consent procedures in research. So certainly de-identified data makes it exempt. But my sort of invitation is we could do better, right? Which is that we could inform the participant of their involvement in research before their data is being aggregated and anonymized. So these studies here are just a few different examples of retrospective studies looking at large numbers of data from these apps. And essentially, if you look at the ethical statement, they were deemed exempt from an IRB perspective because the data was used in accordance with the privacy policy and terms of use as indicated in the app, which lo and behold, no one has read, but that's okay. All right, so I'm going to move this over to
Okay, what's the next?
Oh, yeah, it's just this little.
Okay. So I have spent a lot less time thinking about this kind of data, because I'm a statistician and a data scientist. So all I'll talk about for now is sort of what the research utility is, both from kind of a public health perspective and then also from an individual perspective. And the kind of work that briefly that we've been doing with this. So if you have menstrual cycle data in theory, right, the kind of thing that you can infer is if someone becomes pregnant, or if they don't, things like when they ovulate over the course of the cycle, which is sort of something you might want to know. The one thing that from what I understand, we don't have a great sense of is what the variability is, sort of person to person, and even within a person from cycle to cycle around these kind of textbook trends. So, well, okay, those graphs are there, what you can see. So basically, we find in real data, even if we just look at individuals who sort of self-reportedly are healthy, don't have any particular reproductive disorders, the distribution of just length of cycle is sort of centered around 28, but actually has a pretty big distribution. And then the distribution of sort of when hormones are peaking and things is also pretty variable. So this plot was meant to be the day that luteinizing hormone reaches the maximum, which is an indicator of ovulation. And that is also really quite variable, even in just healthy subjects. So from again, from sort of a public health perspective, understanding that is really useful. Right, we don't all look like the textbook all the time. So these are average hormone plots that we see in those sort of healthy controls over sort of cycle days. So you can kind of see, again, from that kind of aggregated perspective, the kinds of things that we can learn. And then we can also try to model it. So on the right is just a model that we try to use to kind of capture what these patterns are here. In what parts of the cycle are different hormones rising or falling or sort of staying constant. So that we can try to sort of take in this cycle data and make sense of it. So when are people within one cycle moving sort of from one phase to the next, and maybe try to use that to predict things that might be useful for that person. Another thing that we can try to do is understand better how different reproductive disorders work, how they manifest. So PCOS is polycystic ovary syndrome is, I believe, the most common reproductive disorder. But has sort of it's not a straightforward diagnosis. There are a lot of sort of subtypes and ways that it might manifest. And so better understanding that is really helpful if you are trying to go ahead. So things like PCOS and other sort of reproductive disorders can make it more difficult to get pregnant if that's what you want to do. And can also sort of cause other problems. So being able to diagnose that more quickly, potentially based on this kind of data, could be very helpful. So for example, this is just kind of one thing looking that we can tell pretty well just based on a single person looking at their average cycle length over time. That distribution is a lot more kind of stereotype for healthy controls and is more variable for people with PCOS, for example. We can also look at different sort of hormone thresholds. So for example, if you kind of go back to, it doesn't look like it's just a quick. Yeah, there we go. Going back to here, there is, oh, this isn't all done. Okay, sorry. Basically, if you sort of pay attention to up here, when different hormones are doing different things, you can sort of set thresholds to say, you know, if I see luteinizing hormone hit this value, and then I see some number of consecutive days after that where progesterone reaches some value, that's an indicator of ovulation. You can kind of use these as rough proxies for things that you might want to know. So aside from kind of the general public health angle, you would also hope that people who are giving up their data are gonna get something sort of personal back. So, one of the things that we are trying to do and that others, have tried to do is, sort of collect information in such a way that you can tell the user something useful about their own body. So this is just an example of 2 cycles for the same individual. They are anonymized, but if you've gotten rid of that, so super anonymous. Each of the colors is a different hormone, and we're looking over different cycle days. The main takeaway here is just that even within a person, cycle to cycle is really variable, and the data is quite noisy. But things like cycle consistency might be something that's useful to know if you are a person trying to get pregnant and you, and your cycles are not very consistent, right? That's a useful thing to know. So the kinds of things that we can start to learn from and for individual users, right? You would need the individual data, but then can hopefully provide things like, do you have signatures of a reproductive disorder that you might want to go to a doctor for and have treatment for? What did you ovulate in a given cycle? How consistent are your cycles month to month? And then sort of our modeling is aimed at trying to understand how you're kind of moving through the various phases of the cycle. And this can be for a bunch of purposes. I have 2 here, I'm sure there are more. But right, monitoring one's own reproductive health, and then also either achieving or avoiding pregnancy by better understanding that your individual cycle. That's all.
Right, so now I would like to move into a few of the implications for businesses, right? So, how much is menstrual cycle data worth? So whereas a data processing company might spend 10 cents for data on an average user, it could spend upwards of $1.50, which is a 1,400% increase for the data of a pregnant person, which was reported in Privacy International report. Again, going back to that, implications of the user as a prosumer, right? They're both providing data to the company and consuming the value of the app. So could data privacy be good for business? So other than data breaches being bad advertising, are there maybe other reasons for a business to prioritize data privacy? 79% of Americans are concerned about how companies use their data, and 81% feel they have little control over the data collected. So creating a culture of transparency is good for business. So what is an important thing for business to do? It's to create trust with their consumer base, right? It's almost impossible to build trust if the user doesn't know how their data is being used. Certainly users may be willing to suspend some of that trust in order to get the value of the product. But I mean, people will only be so generous with how much they're willing to suspend that trust. Most Americans don't trust social media CEOs to handle users' data responsibly. This is not about social media, this is about apps, but I feel like it's a similar thing where US adults say they have very little or no trust at all that leaders of these companies will admit the mistakes that they've made with personal data, that they won't sell personal data without their consent, and that these companies would be held accountable if they misused or compromised users' personal data. Americans are also largely concerned and confused about how their data is being used. So there's a lot of confusion as well, and that applies both to how companies use their data and how governments might use their data. Many individuals trust themselves to make the right privacy decisions, but they're also skeptical that their actions even matter. So they might sort of think like, well, I do trust myself to make good decisions about, the privacy and protection of my own data, but maybe like how I decide to do things won't even matter and won't even protect the data. So I sort of like to drive home the idea that there's a huge potential of this data when it's used ethically. Data is often perceived as technical, even boring. Yet data has been described as the lifeblood of decision-making, said the United Nations Secretary General's Independent Advisory Group. In public health, we rely, as Lauren mentioned, or as Dr. Sugden mentioned, we rely on self-reported and recalled data of cycle length and cycle regularity, and assess their role as risk factors for many different health conditions. Yet we lack prospective menstrual cycle data collected across the life course. We rely on these tools for valuable valuable data sources. So, so if they're used ethically, if this data is used ethically, it could be leveraged in enormous ways. If it's shared and stored in a way that's respectful of personal privacy and human dignity, it may help expand our understanding of menstrual health and position these companies to provide information about a vital indicator of overall health in women. So just a few different proposals to kind of set the stage for the conversation. So can we imagine a situation where the interests of all stakeholders are met? Could we imagine a table that might have, the interests of the user wanting their data to be used in a way that is respectful of their privacy and intimacy, but then also values the service provided by the business, because these are real services. It takes a lot of money in development to drive these apps. So they can't just give them out for free. So is there a way that we can incentivize these services? Maybe, lobby for insurance coverage, maybe allow the user to be part of that conversation about if their data is sold, maybe have, consumers be stockholders in how their data is, some of these things are so controversial and maybe completely absurd, but certainly worth having the conversation. My biggest hope is that we could have greater plain language privacy policies, even if we have, that legal document, fine, but then have the abridged version of the privacy policy so the user really understands what they're consenting to, right? So there's really, it's like when you're going through a medical procedure, you have that legal document, you have to sign that legal document, but most of the time you have a conversation with your healthcare provider and they explain to you in plain language what you're consenting to. So we can't really call it consent or even an acceptance of terms of use if there's not an acknowledgement or an understanding of what we're consenting to. Greater transparency on data use. Sometimes I think businesses are afraid of transparency. They think, well, maybe the user won't actually want to use this service if we tell them exactly how we're using their data. Well, typically, actually, based on the statistics, Americans want to know how their data is being used. And so they value that transparency, they value the privacy with which their data is being used. I already mentioned insurance coverage or other alternate revenue sources for companies. And then giving back to the user what's learned or gained through data sharing. The least we could do is sort of give them a return on their investment. So if data is how they're investing in these apps, give them a return on their investment. And then specific protections, I think, should be applied to menstrual health data. There aren't too many other apps or other digital health tracking technologies, in my opinion, that are collecting information that is as intimate or as personal as this kind of data. So I think even if we can't apply these protections to all digital health technologies, maybe we could specifically apply them to menstrual health data. It does exist. There are apps out there that do value data privacy. One of those is Read Your Body, which is a menstrual health app that was developed by a nonprofit. It does cost something. I think it's like $24 or $25 a year. But the data exists only on the person's personal device. They do not own or store your data anywhere. So I think that's valuable to know that there are options. So, many women are deciding that they don't want to track their data. But I think that's a missed opportunity because this data is very valuable to women's health and it is very valuable for research. So can we create means of valuing the privacy, teaming up with the user to create a way to keep everybody's interests in mind. And then just a few acknowledgements. Obviously, the Grefenstette Center for offering this opportunity. Our research, Dr. Sugden and I, our research was funded by the Duquesne University's Faculty Development Fund. My research mentor, Dr. Melissa Clarkian, and our undergraduate research assistants in the School of Science and Engineering, Alexis Tripp. And I also would like to thank Mira for allowing us to use their data and for being interested in research and for giving us data that was that protected the user's privacy. I just included this here because the conversation would require that information, but I'm happy to open the floor for questions for Dr. Sugden on this.
Yeah, I'll start with the question. Thank you both so much. This was really, really interesting and fantastic and reminds me a lot of the current debates around 23andMe. Right, which are very similar debates because they're about, 23andMe is, the personal genetic screening service. And a lot of these same debates are about how is your genetic data being used. Do you see similar sort of like policy pushes from sort of both camp? Like, are those interlocking conversations that are happening, or are they really just like separate pieces that meet every once in a while when they're agreed upon something? Or is that the same conversation?
But you worked more with genetic data than I did.
Yeah. So I don't know what is happening.
Yeah.
But I do think they are very related. I mean, yeah, there's a lot that you can, certainly from genetic data, there's a lot you can learn about, but, what's the word, like predispositions to diseases, right, things that are directly relevant to health, sort of the same way that this data is. So they're not exactly the same, but there's a lot of overlap in that case, and just in sort of that kind of intimacy of the, personal data that someone can't appear in your house and see.
Yeah, and also, it is a transaction in the same way that the currency, right, is the individual's data, right? Because there is no way, I mean, I can tell you from my own postdoctoral work in epigenetics that it costs about $1,000 to run someone's genome, right? How much do you pay for 23andMe? It's not $1,000. It's, yeah, right. So how are they making up the difference, right? I mean, it's clear, right? And the individual knows that, right? I mean, they do know that. I mean, there's, even though they know that, there are still lawsuits and stuff like that. And 23andMe, I think, has been sued a lot. I mean,
Yeah.
several times. So, they still seem to be okay, but, so I think that it has really, it has made everybody suffer by not having this conversation, because we sort of think like it's best to just steamroll through this and just like, make I mean, again, I worked in the private sector in a startup. There's so many pressures on these companies. If you don't make it, then you don't make it, and so it's hard to justify like, worrying about the individual privacy of an individual user if you're not making any money. Right, and so I understand the pressures of the companies, but I think there is a lot of pressure, especially in our current, the current conversation, to sort of like, to look at this conversation again and to, and to value the privacy of the user, because people are turning away from these apps. So it is in the best interest, maybe not short term, but we sometimes think very short term, longer term interest of the company to keep the users' interests in mind.
Another thing they have in common too is, which maybe will be true of other data buying and sharing, but that the pace of research is such that you might not know what you're consenting to in the moment, right? If you are, I'm thinking in genetics in particular, but it'll be true here too. What you think you were consenting to in 2015 or something is maybe not what's happening now, both because of what researchers sort of can discern from your genetic data or can discern from your menstrual cycle data, but also in terms of like the legal landscape of where you live, or so I think maybe part of the privacy conversation too is that right, what is it, right to remove, the right to.
Yeah, right, to delete, or even like right to select what information is shared and not shared.
Yeah, but to be able to go back
Right,
many
and
years later and
yeah.
say, I don't want this stored anymore. I just deleted my 23andMe profile and I don't know if it deleted my data.
Yeah. Well, and it's usually it's incumbent upon the user to determine if there's been any changes in their policy over time. So you could be using, I mean, like in the case of menstrual cycle data, you could be using these apps for years and years and years and not be aware that there's some change that was made and now all this sort of data is being shared when it wasn't originally going to be shared.
So I think one of the most important points you made was, why are we having this conversation now? Like, it's really so late in the game, because these apps have been around for a long time. And as you know, through facts, we did a review of fertility tracking apps in 2015 that were being marketed to prevent pregnancy. And one of the reasons we downgraded so many of them was because of either lack of privacy policies, or they weren't clear about how they were using women's data, or what was worse is they were being marketed for preventing pregnancy, and then in the fine print had a disclaimer saying, like, don't use these to prevent pregnancy. So I just want to acknowledge you and thank you for like raising the issue and pointing out, like, we're really a decade too late in having this conversation. So I very much appreciate the work and the research that you're doing in this area. My question, I want to just talk about in terms of some of the biomarkers. I'm glad that you highlighted the different biomarkers, but as you know, for clinicians, as physicians, one of the most important biomarkers is the cervical mucus observations. Like, that's the one observation that's universal to most of these fertility tracking methods, but one of the most challenging ones to track and to record, because like with basal body temperature, it's a number, it's the same number, but with cervical fluid observations, you know, there's more variability in how the woman observes and how she reports that. And so my question is what's the balance between like a billing calculation method where it's like you write down your observations in your own words versus a Creighton where it's a very specific recording system from a research perspective in terms of tracking the cervical mucus observations? Where do you think we should fall in terms of how apps would record cervical fluid observations from a research perspective?
I mean, I think it's gonna depend on the question being asked. So, I mean, I think it's, you know, I think there are many different ways to track and identify ovulation over time. You know, whenever I work with, you know, students or even patients, I always tell them that the best biomarker is the one that you're able to confidently, and efficiently and frequently track, right? So I think from a research perspective, and I think there's already been publications that have demonstrated the value of all these biomarkers.
Right.
I think the consistency is very important from working with Dr. Sugden. It's sort of the number of data points per cycle over time. So in order to get good predictions, you need enough data points, right? So it's, you know, it's even if you have a great biomarker, if it's only tracked once or twice, it's not going to give you the same value, even if it's overall a great biomarker. So I guess my best answer to that question would be that, like, if it's tracked frequently and consistently, then I think it can be used no matter what biomarker it is. Certainly there are ones that are more, there are biomarkers that are sort of easier depending on different lifestyles or whatever. Like temperature tracking is certainly a big one. You know, cervical fluid changes, urine hormone concentrations, which is one that, you know, Dr. Sugden and I are looking at. You know, there's so much data and there's so much potential. I think the point of this conversation was really to sort of address the intimacy of it and to kind of talk about the various stakeholders involved in the conversation. Certainly clinicians would be a stakeholder. I didn't really include those, that as a stakeholder, but the clinician sort of defers to the patient. And the clinician is not directly involved in the patient's decision to download it. Yes.
This is a very interesting discussion, and I think what you have done are very important. Data privacy is also one of my research interests. And I also work on the GPDR in the context of the cookie setting.
Mm-hmm.
And from our research examination, we find that we actually surveyed the Fortune 100 companies, and even among the Fortune 100 companies, 10% of them actually did not set up their cookie settings legally. My observation shows that it seems the regulations or the enforcement of regulations in Europe are much stronger than
Yes.
what we have here, right?
Yes.
We know that for the cookie laws, Apple's and Google's have been fined a lot. So I wanted to know your insights or your observation that any difference in terms of how to regulate personal health data between the States and the Europe. My second question is, I'm not a medical expert, but I know when I go to my doctor's office, I need to sign the HIPAA form,
Yes.
right? Do we also see that in some of the apps, terms or settings that we can turn on? How do you see that would be related to the regulations of electronic personal health data?
Yes, yeah. Yeah, those are great questions. So actually, that's why I included this slide, because I knew someone was gonna ask about it. And so, General Data Protections Regulation, or the GDPR, is the privacy laws that regulate these technologies in Europe. Much stronger protections, much more control is given to the user, which I think is important. And actually, some American companies are trying to fashion their privacy policies around Europe. But certainly there's no requirement in the United States to follow these. California's law, the one that I presented, is the closest to the GDPR. You can see these are the main kind of things in the references. You'll see, you can look up the GDPR. I mean, it's well, delineated what it covers, but certainly the focus is on transparency, control by the user, so you can delete your information anytime, change the sharing mechanisms. I actually failed to mention this part about data minimization, which I think is really important, which is to only collect data that's required for the service that you're providing. We definitely don't do that in the United States. We just know that data is valuable, and so we collect absolutely everything that the individual is willing to provide, right? So like, if the individual is willing to provide it, why not collect it, right? So if it's not, my recommendation is, if it's not required for you to get into the app, like if you don't have to put your birth date or your email address or your phone number or your social security, like don't put it, right? Because that's not required for the service. So always ask yourself that question: is this required for the service that I'm actually getting from this app? If it's not, then they're using it some other way, right? And again, I know I'm painting a fairly grim picture of businesses. For sure, I feel like there can be proper solutions to these dilemmas that we're just not really talking about. So I feel like one even first step would just be to minimize the amount of data that's collected and ensure that it's only the data that's being collected is what's necessary to provide the service to the user, right? So some really interesting things. I guess to answer your question, unfortunately, this is not required in the United States. Certainly companies can do whatever they want if they, but my opinion is the way things are going with consumer interest in privacy and transparency, I think it is to the benefit of companies and governments to ensure that their data is being protected, right? In a similar way that we don't allow people to intrude people's homes, right? We shouldn't allow them to intrude my correspondence or my app data, right? So, and then the second question was about HIPAA. Unfortunately, absolutely not. There's no requirement for this data to be covered by HIPAA. Anything outside of a health exchange or like a healthcare provider patient relationship is not protected by HIPAA. I think it would be great if certain types of data was protected by HIPAA, but the way to do that, it would have to be covered under some larger institution or relationship then. Like who's determining the nature of that data, I guess. I mean, there's a lot of legal jargon that I don't have expertise in.
So, excuse me, with the proliferation of medical devices being put online, and I'm thinking of some, a few incidences would be like the Apple iPod, pods that can now act as hearing aids.
Yes.
Or devices that are tracking people's blood glucose.
Yeah.
All of this information, some of these companies have to go through an FDA process to get approval. What's the threshold for that? Because it sounds like the R ring had nothing in terms of approval.
So I don't know exactly if the Oura Ring might be FDA registered. There's different levels of
Levels,
FDA
right.
approval. I know for sure within this field, Natural Cycles is FDA approved for pregnancy prevention. But that just speaks to its, it being approved for that specific medical purpose. It doesn't mean that the data that Natural Cycles collects has to be stored or managed in a specific way. So I don't know if that addresses your question.
Yeah, and I just,
It also speaks to sort of whether or not it's covered, it maybe like the person could cover, get that service covered by insurance.
I guess I was also just thinking about the proliferation of this kind of data being used in multiple ways. And it's kind of astonishing.
Yeah, and again, I'm not against using data, right, for good
Right.
things. I mean,
No.
we obviously are using data for hopefully a good thing, right? But like it's, what I am against is not having plain language privacy policies where the control is still primarily in the consumer's hands. And my perspective is that doing that is not gonna undercut business in the long term. It's going to only benefit business. And benefit governments if we create a relationship of trust and transparency. Yes,
In your researches, did you find out or at least get a sense of who's buying the data from the apps and what they're doing with it?
they don't disclose that. So,
That's private.
That's
yeah. I don't know. I mean, certainly people who are willing to buy it, right? I mean, certainly within pregnancy data, a lot of it is used for advertising, which is why it's expensive. But femtech, which is that, the industry that includes menstrual cycle apps, I mean, is worth so much. So I'm guessing it has to do with consumer behavior, consumer like geography, kind of like where are the people interested in these types of things, or this type of product, or, I think most of it is to build consumer bases for other companies.
I was thinking more.
I always kind of laugh because people say, well, like, what if the government, what if the government use this data in a malicious way? I mean, Dr. Sugden is an extremely talented data scientist. And there are many talented data scientists looking at this data. It's extremely complex. We put a lot of credit on the government to know exactly what to do when they look at this data. So I always try to say really that's not where we have to worry, is like how someone is going to use this data in a way to legally, affect someone. It's more just can we use this data in a way that's protecting the user and protecting the intimacy of the data. I mean, it doesn't matter if it's legal or not, it doesn't matter if it's legal or not. It's like, as far as I know, it's illegal to look into someone's house and trespass on their property. It's the same thing, I think, in this.
I was thinking more along the lines of insurance companies that
For sure.
maybe be using that to increase the price of their policies, premiums or something along those lines.
Yeah, fair enough, yeah. I mean, I'm sure you and I can only just imagine the ways it's being used and reused and reused and resold and repackaged and resold and, I try not to get too conspiracy theory about it because sometimes the things you see on TV are just not really realistic, but certainly the data is being sold, certainly. And they say that it's being sold, you just have to read the. So I think people are oftentimes well, I feel like I was betrayed, they used my data in a way that I didn't. I sort of say, well, actually, they are using a data in a way that you agreed to. If you aren't happy with that, then delete the app and find an app that doesn't store or sell your data,
Right.
because they do exist. You just might have to pay a small amount for them.
All right. Time for maybe one more question.
There's one in the chat.
I would say there's one in the chat too, but we'll prioritize anybody in the. Until one.
I remember there was a couple of years back, there was an article about a guy who had a daughter who had been getting ads from, I think it was Walmart.
Yes.
For a lot of products that were associated with pregnancy, and
Yes.
he was mad at Walmart. He's like, hey, why are you trying to tell my daughter to get pregnant? And then basically he found out that his daughter actually was pregnant, but because of various different tracking apps and other data that was probably being accrued from her
Yeah, that
cell
was
phone.
Flow.
Yeah.
And they definitely sued Flow, and Flow is definitely out a lot of money.
Yeah.
So, again, it's bad advertising for the company, so so for sure, because they inferred that the person was pregnant based on the data, which is what we were presenting. You can infer quite a lot from this data. So it is valuable from that perspective to the user, to public health, to individual clinicians. I think that was the question in the chat about, what do OBGYNs think about this? How are they guiding patients? I'm not an OBGYN. I know Dr. Duane is a family doctor. Maybe you want to speak to how physicians are guiding patients in this conversation?
Well, I mean, as you know, most physicians are not actually very well versed in the apps themselves, in terms of like how useful they are and evidence-based they are, and even understanding the validity and the usefulness of these apps. And a lot of the rating systems in terms of the apps are about like how easy they are to use or how nice they look, as opposed to maybe how accurate they are. And that's, why we try to host conferences to educate on the use of these apps, because the reality is the patients are using them. And if I ask any patient, like, when was your last period, they'll let me check my app. And interestingly, and I think you've seen this, a lot of women will actually use multiple apps. So it's like they're putting their data out all over the place.
Selling their data many times.
But there's a huge knowledge gap among the medical community, just among the apps themselves and how useful they are and which ones are effective, which is why we need more research in the area. And I know you're doing the research with Read Your Body, and that's one of the apps that doesn't sell the data. And I think that's important for people, because I get that question a lot. Like, if people ask me, which apps would you recommend? It depends, right? And I'll ask that question, like, do you care about what happens to your data? Who has your data? And so Read Your Body is certainly one of the ones that I would recommend.
Yeah, I mean, not only do you not sell the data, they don't store it
Yes.
anywhere.
So,
You have to back it up personally on your device if you want to keep it, otherwise it just gets deleted.
but I also do want to highlight, like, there is value that comes out of this. I mean, I know there was a large study that looked at data from the Cinto Pro app and the Kindara app that really helped us better understand the length of the different phases of the cycle and kind of debunk the myth that women have 28-day cycles. Like, that's
Right.
only 15 to 20% of the time. So many of us believe that. And so there is good. It's the balance.
No, we certainly informed the medical community from this data.
Yeah,
I just hope that we can develop research protocols that's going to
protect the
protect
patient.
the patient
Absolutely.
and also work in accordance with typical research policy, which is to collect informed consent.
Yeah.
Please join me in thanking one more time. Please feel free to linger, help yourself to coffee and snacks in the back. And come up and talk to our wonderful speakers as well. And stay tuned, make sure you sign up, make sure you sign up for our email list so you can know about future things we'll be doing in the spring. Thanks, everybody. If you're one of my students, be sure to sign in as well to get credit. Thank you.
Yeah, so I worked on. That's the one that I'm, if anything else, now I'm seeing when we get on my side. Really, Some of them yeah, to climb, but some of them. So we basically. I was